Welcome to the show tonight. I'm Dawn Scott, and I'm alongside our governor, Asa Hutchinson, on this Friday night. Thank you so much for being here, Governor.
Good to be with you, Dawn.
I'd shake your hand, but we're not doing that anymore. Things have changed. Things have really changed.
They have changed, and it'll be interesting to see if we actually go back in time in the future, which I think we will. But this is something dramatic for Southern folks that love the hug, that love the handshake, and it's really hard for politicians, but it really is important. I've changed my habits dramatically. I joke that I play with elbows in basketball, and they're coming in handy these days.
Yeah, exactly. You know, I wanted to bring you in because people are inside tonight. They're isolated, they're socially distanced, maybe they're with their families. But I think it's important to know that you are here as our leader, that you're going through this as well with us. And as a state, we are experiencing something that we've never experienced before. And I think my first question tonight is, how did you prepare as governor, and how did we as a state prepare for this?
Well, our officials practice. We practice for pandemic, we practice for infectious diseases. And then when this happens, we have some preparation. But this is different than we've ever seen before. And even though you practice and prepare, you also have to adjust constantly, and then you realize there's limitations, just like, you know, our hospital systems, our beds, our, you know, the CDC and the testing capability. And so no matter how much you prepare, there's still challenges you have to address. You know, I've been through some challenges before when I was at Homeland Security and dealing with the SARS epidemic back in 2004, and so I've had a little bit of experience there. But again, nothing that has impacted the home state, the families close at home like this is. And you know, just little things, which is a big thing, of having to cancel the final games of the state basketball tournament or postpone them. I knew the players, I knew people who were there, and my grandsons play, and that's not easy, and I know what that means. But the way people of Arkansas have accepted it, they understand it, they try to make good decisions based upon good public health advice, and so people are responding tremendously. And doctors, I want to just say, our nurses, our doctors that are on the front line, they are really sacrificing, knowing that they have a tough job to do in difficult circumstances. I really thank them and applaud them.
So some of the facts right now, there are 9 now presumptive cases of COVID-19 in the state. Is that still accurate, or do we know of any more at this time?
That's accurate. They're still testing one, I understand, and they could change the numbers tomorrow, but those are 9 confirmed, presumed positive cases. And we'll see what it looks like tomorrow. And
let's talk a little about, you addressed this in your press conference this afternoon, but not everyone was able to see that. There's some concern over testing or what to do if you're sick. We're not wanting people to go to the emergency room or to doctor's offices necessarily. You're advising people, along with your health cabinet, to make a phone call.
Absolutely. You don't want to go into the emergency room, because if you are in fact positive, then that's going to expose so many. And so you call in advance and determine where you should go to have the swab that they can test then. And so that procedure should be followed. In most hospitals, again, have a sign on the door, doctor's offices, as don't come in if you believe you have symptoms for this.
And that's one of the concerns, is testing. The health department saying that right now they could really only handle about 20 tests per day, but you're working to help change that and increase that number.
Well, very quickly. And we have UAMS that has a new machine that's coming in to allow them to test. It will take us about 10 days to get that online. We have the Department of Health that's trying to expand its throughput. But then also you have nationally, you saw where Walmart was on the front line with the President of the United States today, looking at private sector options to help speed this up. But ultimately we have to have more of the testing machines. Even though we have more collectors, we either have to have the quick test on site, or we have to send it to a central location. and we're trying to develop that capacity here in Arkansas.
Governor, are our hospitals prepared? I understand that we have at least 2 of these 9 patients are hospitalized. Are we prepared for them to be in the hospital right now?
We're prepared for them, but are we prepared for thousands more? And both in terms of testing or whether they need assistance. Now, you know, many that come in for treatment, you know, they are released back to their home for home confinement, and they're not serious enough to take long-term hospital care, but others need respirators. They need more intensive care. One was in intensive care, one of the ones that tested positively. So it will be a challenge for our healthcare system, and that's why we want to lower the number of potential cases out there, because if it goes broadly, it can overwhelm a small system.
Absolutely, was my next question. There's no way that you can predict the future, but you can prepare for it. So a lot of people have been saying, hey, Dawn, do you think that they'll, you know, cancel school past March 30th? You know, what's going to happen? Of course, you know, we don't have the answers, but it is a possibility. It's likely a possibility.
Well, I'm glad you brought up the schools because we're trying to follow our CDC, our health professionals' guidance. And the CDC said that it's not effective simply to close schools for long periods of time because then where the children are going to be, you know, where their needs are going to be, and is it effective? And the experience is it's not effective simply to close schools. Now, if we have a student in a school that tests positive, well, we're going to close the school for a couple of days. We're going to have a deep cleaning of it. We're going to isolate the student at home, and then we're going to go back to classes, will be the longer term plan. If you say we're going to close all the schools in Arkansas now, then they're going to come back from spring break. We're still going to have this challenge, and you cannot just say we're going to close schools this year and next year.
Yeah.
We have to continue, and there's not any evidence that it's effective. And so we're trying to listen to our healthcare professionals, the CDC, on these points, and that's what they advise.
And it goes to the point too of, you know, our normal is not our normal anymore. It's going to be a new way of life for us here in Arkansas and across the nation and world, really.
Well, we're anxious to see what that new normal is, but I have no doubt that we're going to get through this hump, both economically, but also in terms of health care. And when we do, we will have learned a lot. I have confidence that we're going to be able to develop a vaccine for this, and I think we'll be prepared, hopefully soon, for the future as it will be defined in this new environment.
Any last message that you may have for people out there? Somebody maybe feeling at home with all their kids, looking ahead at the next couple of weeks, going, "Oh my gosh, how am I going to get through this? How am I going to work? What's going to happen here?" Any message that you want anyone in Arkansas to know right now?
Well, that we're working very hard to ease whatever burdens we can, but also everybody's standing with each other, even though we have some social distance. We're neighbors, and we love each other. We want to help each other, and you know, First Lady and I and my daughter, we're going to go out for dinner tonight.
Yeah, they're here.
And so, you know, you behave smartly. Yeah. And so we're trying to reduce some of the mass groups, entertainment, the large venues, which the mayor appropriately supported us on. But life goes on, and I think people need to understand that, not panic, but we're going to get through this and rely upon our healthcare professionals and support all of the ones that are working hard to make the system work and to get over this.
Yeah, Governor Asa Hutchinson, thank you so much for being with me live tonight on 630 Central. We appreciate you. Enjoy your dinner, and I know we'll be talking to you in the coming days and weeks.
Thank you.
Thanks so much. Peggy Kelly is a licensed professional counselor. She's with me now. She is with Youth Home, and she reached out to us to cancel the group's exhibition event. A lot of groups are canceling events right now to prevent the spread of this virus, but it's having an impact on people, and you're seeing this in the real world.
Absolutely. I think everyone is getting anxious. I was sharing with you a moment ago, I'm not an anxious person, but when you talk about it all day at work, you come home, it's on the news, it tends to wear on you.
Yeah, and so this buzzword or words of social distancing is the phrase from the infectious disease perspective, but it's, no doubt slowing down a disease, but we're social creatures and by nature want to be around people, and we're not going to be for a few weeks. What is this going to look like collectively and also individually?
Right. It's a difficult time, and you need to connect. It's really important to connect. This is one of the few times that we can say that technology is really our friend.
Is that what you advise?
Absolutely.
Maybe FaceTime, maybe phone calls. What do you advise?
Absolutely. FaceTime, social media, healthy social media use. Phones, just checking in with the people you love and care about, sharing funny videos with them. It's important.
How do you talk to your family members, especially younger ones? Basketball tournaments, other sports events have been canceled. They've worked all season for this. They're sad. A lot of times littler kids don't really understand what's going on.
Sure, and I think it's important to help them be a part of the preparation and help them understand that there are many, many people out here trying to keep them safe.
Yeah.
Action is an antidote for anxiety. And so doing something, preparing, wiping down the counters, cleaning, tidying up, that type of thing is really helpful.
Being together as a family.
Sure.
Yeah.
Sure.
What do you advise if someone is maybe feeling depressed or maybe feel like they need, a little extra help? What do you advise they do? Where are resources?
Sure. Well, I think reaching out to people that you care about, that you can talk to, but if that's not an option, contacting a counselor is a great idea. We may be doing more telehealth as time goes on while we're trying to keep this distance. But also there's things you can do on your own, taking care of your body, movement. I talk a lot about gratitude. That can be an important component of your mood.
Peggy Kelly with Youth Home, thanks for being here through all of this. We'll be right back.